thank you everybody for joining us today for our Monday morning COVID-19 Miller-Johnson response team roundup. I think we haven't done a Monday morning roundup in a couple of weeks, so thank you for joining us today. I don't believe we plan presently to do a Monday morning roundup next week, but keep an eye on emails. We may end up doing that depending on how things go over the next week. But it's nice to be back here with you. And I'm here with Sandy today. We're largely going to be covering the topic of interest that I think most people probably are attending today's webinar to hear about, which is the implications of Governor Whitmer's announcement last Thursday about the early or accelerated rollback of certain orders and mandates and what exactly that means for businesses and employers. So that'll be the bulk of the webinar today. And thankfully we have Sandy with us, who, as many of you know, has been following those requirements and developments very closely all along the way over the last 15, 16 months. So she's gonna help us, including me, frankly, better understand what that means for businesses and employers. And then briefly at the end, this is Erik speaking again, I'll provide a brief update on some PPP loan forgiveness trends and ongoing borrower obligations, even for those who have received forgiveness of their loans already, and then just a handful of other recent SBA related developments. So with that said, I think as I said, the bulk of today's presentation will be Sandy. So I'm going to turn it over to you right away, Sandy, and I'm going to go on mute and turn off my video and listen to hear what you have to tell us about this latest update.
Sounds great. Thanks, Erik, and good morning, everybody. So as Erik mentioned, we have some important and exciting news to talk about this morning. As we all know, probably most of you on this call, late last week, Thursday, the governor announced that the state would open to full capacity on June 22nd. Previously, the governor had talked about this July 1st date as being a target date to relax a number of COVID-19 related restrictions. And she issued a press release last Thursday and a MDHHS order last Thursday that is to take effect tomorrow morning, so Tuesday, June 22nd, indicating what MDHHS orders will be rescinded effective tomorrow. So it's important for us to kind of get our bearings and talk about what her announcement tells us in terms of what's going away, but what her announcement also tells us about what mitigation requirements are still on the table. So in the governor's press release, she listed a number of MDHHS orders that would be rescinded tomorrow, and I've listed those here. The gathering and face mask order, temporary restrictions for entry into congregate care and juvenile justice facilities order, a couple of mandatory testing orders, restrictions into entry on congregate care and juvenile justice facilities, exceptions to temporary restrictions on entry into certain facilities, including hospitals, okay? Safe housing for housing unstable individuals, handling of bodily remains, and safe housing for Michigan homeless. And as you look at that list, and as it was included in the press release and in the rescission order, you think, oh my goodness, that's a lot of orders. That must be everything, but it isn't, okay? And so the governor's press release went on to say that some orders would remain in effect to protect particularly vulnerable populations in connection to generally corrections, long-term care facilities, and agriculture. So if we move to the next slide here is the list of existing MDHHS orders that are not impacted by the MDHHS rescission order that goes into effect tomorrow. And so this is kind of how we will format the rest of this section of the webinar. We talked a little bit about what the MDHHS order does include, and then we'll spend some time talking about here are the COVID-19 related mitigation obligations that you may have as a business or an employer that are unchanged as a result of this MDHHS rescission order, okay? So starting off first, there's a number of MDHHS orders themselves that are not included in the rescission order that goes into effect tomorrow morning. And in fact, MDHHS just recently issued an updated order on June 11th related to mandatory testing, various preventative measures, and safe housing for agricultural workers. That was a revision of an order that originally went into effect last August. And so just a very recent update. And as the press release said, of course, most of these mitigation requirements are in the area of corrections, long-term care, agriculture. So all of the testing requirements for skilled nursing homes, homes for the aged, and adult foster care facilities that were just updated in May, those are still effective. Requirements for residential care facilities that include some entry requirements, those were just updated in May, those are still in place. Various requirements for hospital laboratories and health professionals generally about how to report cases is generally what that order covers. That went into effect in January. That's still on the table. So there's a number that are still on the table. Obviously, the big news here, right, is the rescission of the gathering and face mask order that was included in the previous slide. And so what we know about that order, right, we've been talking all along that that order tells us if we, whatever we're doing, if whatever we're doing is subject to a capacity restriction, right, if I'm hosting a social gathering at my own home, or if I'm a business, certain types of business, food service is a great example. Am I subject to certain types of capacity restrictions? So that's the first piece. And then the second piece, right, just as the name might suggest, of the gathering and face mask order, the second piece is what are my obligations as I'm hosting this gathering, or I'm sponsoring this gathering, or I'm in charge of this gathering? What are my requirements to make sure that folks are wearing face masks? So, right, a couple of months ago, the big news was we were following the CDC, and that unvaccinated individuals, MDHHS was saying unvaccinated individuals don't need to wear face masks. So businesses, you can relax that restriction, but here's how you need to do that. You need to make some good faith efforts to inform folks that it's only fully vaccinated people who can be without a face mask in your establishment, so on and so forth. So that gathering and face mask order goes away. So we've gotten a number of questions prior to the webinar today, and I would say 95% of them go, well, what about the OSHA order, Sandy and Eric? What about the requirements in that? And so we'll just go ahead and go right to the next slide. So the existing OSHA rule is not impacted by the MDHHS rescission order, okay? So for employers and businesses who are on the call this morning, you could give song and verse on this rule. I'm sure you could. It originally became effective back in October 2020. It was just revised at the end of May. And the current expiration is October 14th, 2021. So unless this rule, as we've said all along, unless this rule is rescinded or revised, we plan for it to be in effect through into October 14th, 2021, okay? Now, of course, again, those who are subject to this rule could give song and verse about this. We know that this rules, the document itself, right, is a rule, but it's made up of a number of rules that include various requirements for COVID-19 preparedness plans, basic infection prevention requirements for all employers, health surveillance for all employers, right? Those are the daily entry screenings that were required to put our employees and contractors who are working on site, putting those folks kind of through that exercise. Workplace controls for all employers, and it's under that particular rule that the masking and distancing requirements for your unvaccinated staff live, and training requirements and record keeping requirements. Obviously, I'm speaking pretty broadly here. But those are the general requirements of the OSHA rule. And the MDHHS rescission order does not impact the existing MyOSHA rule. What we do know is MyOSHA has told us that they are planning an announcement for tomorrow at some point to speak to the impact of the MDHHS order on the MyOSHA rule. We expect them to be giving us some guidance, right, to say, right, the MyOSHA rule is unchanged and it's going to be unchanged, or here's some changes that we were making, or it's entirely possible, I suppose, for them to say we're rescinding this rule in its entirety. But until we hear differently from them, we all must move forward presuming that that rule is still in place exactly how it is. Now, because we know that they are planning an announcement for tomorrow, we are scheduling a webinar for Wednesday morning to specifically dig into whatever it is that we have learned based on their announcement and how that might impact employers. So hang tight for that. But as we sit here today and as we look at our planning for tomorrow, do I need to continue to have my unvaccinated staff wear a mask indoors when they can't socially distance? The answer is yes. Do I still need to put all of my employees and contractors through the daily entry screening as we sit here today? The answer for tomorrow is yes. So all of those pieces remain in place. Okay, let's go ahead and move to the next slide, and we'll talk about the next piece that is not impacted by the MDHHS order and wouldn't be impacted by any announcement that MyOSHA makes tomorrow, and that is, at least here in Michigan, Michigan's COVID-19 Employment Rights Act. So you might recognize this as Public Act 238. That's the illustrious title it had when it first went into effect. It's since been given a title. But this is the law, right, that went through the legislature. The governor signed it. It is a law that essentially tells us as employees and employers, what are my requirements for isolation and quarantine related to COVID-19, right? So generally there's a couple of triggers, right? If my employee tests positive for COVID-19, if I'm an employee, these are my obligations to stay out of the workplace. If I'm an employer, these are my obligations to keep you out of the workplace. And those same kind of dual obligations, if I'm an employee who is displaying the principal symptoms of COVID, or if I'm an employee who has had close contact with an individual who tests positive. Now, you might remember this was originally signed back in October of 2020, and it was a little bit of a head scratcher because it was retroactive to March of 2020, but it was recently amended. I say recently as we sit here at the end of June. December is recently to me, I guess. Amended in December to start to recognize that it makes a lot of sense to kind of hitch those isolation and quarantine requirements to the CDC recommendations, right? So before those were kind of hard and fast numbers, and now it essentially says, hey, if you've got an employee who's tested positive, right, they've got to stay out of the workplace as long as the CDC says people who have tested positive should stay out of the workplace. And right now, that's right, that's generally 10 days since the positive test or symptom onset, whichever is later, 24 hours fever-free, other symptoms improving. We kind of all know that like the back of our hand. If an employee is displaying the principal symptoms of COVID, they too should do whatever it is generally the CDC says they should do. And in Michigan, we also say, hey, if they get a test and it's negative, they're not required to fulfill an isolation order, except for if they begin to, right, if they continue to display those principal symptoms, we have to keep following that protocol. And then if we have an employee who's a close contact with somebody who's tested positive for COVID-19, again, we generally have to keep them out of the workplace anywhere between 10 and 14 days. That's generally determined by your local, right, your local public health authority. And remember, there's certain folks that are exempted from that close contact quarantine. One such person is somebody who is fully vaccinated. They're not subject to a close contact quarantine, provided that they are also asymptomatic. And then there are certain types of employees that are exempted from that close contact quarantine. Healthcare employees are one of those such people. So, so again, as we plan for tomorrow, and we think, because we read the press release, right, that says all of the COVID-19 restrictions are being lifted. Yes, those listed in that MDHHS order are being rescinded, but this Michigan COVID-19 Employment Rights Act is not dependent on those MDHHS orders. That is something that stands on its own. So until that is rescinded, that is in all of our lives forever and ever, right? So that's right. It doesn't have a hard stop sunset on it. So that is something we will continue to be subject to tomorrow as well. Okay, let's go ahead and go to the next slide, and let's talk about, from a federal standpoint, what are some of the obligations we have that are unaffected by the MDHHS order. And several of you in your questions to us spotted this, and so I'm thrilled that you have, because it's an important as you go through the analysis on, okay, thanks MDHHS for the rescission order, but what the heck do I need to do on Tuesday? And some of that math is taking a look at what is going on in the federal government too, right? If Michigan decides to get rid of all of the things, what has happened in the federal landscape that still matters to us here in Michigan from an OSHA standpoint? I don't want to say crassly that we haven't been paying much attention, but we know here in Michigan, we're subject to a OSHA approved state plan, my OSHA, and our state plan has passed an emergency rule that we have been following for a number of months. And so until a couple of weeks ago, the federal government had no such rule in place. And so our rule here in Michigan carried more weight than any of the federal guidance, right? So we were kind of just focused on what's happening here in Michigan. But back on June 10th, somewhat surprisingly, kind of like a phoenix, in my head, I thought it kind of rose from the ashes, that a federal emergency temporary standard was signed. It was to go into effect. It's much different than we were originally thinking. So I'll pause here and say, several months ago, we were really watching the movement on the federal side because a federal COVID-19 related standard seemed imminent. After the change in administration, it seemed that was getting a lot of momentum, and it was something that was going to happen. But then that stalled. And we didn't hear anything for a while. And certainly the vaccination rates have been improving and the case counts have been declining. And so we thought, okay, well, maybe it will just stall and it won't happen. But June 10th came along and we get this announcement from OSHA saying, nope, we are putting forward an emergency temporary standard, but it is just for certain types of healthcare settings, okay? So as you and I might use the term healthcare, it doesn't necessarily cover all of those types of settings, okay? It's very specific. And it generally requires, again, as I talk about the MyOSHA rule and I talk about, 7 to 10 rules, this emergency temporary standard for healthcare generally has about 15 main requirements. Obviously, the devil is in the details, we know that. But generally, those requirements, some of these things might look very familiar to you, right? A requirement for a COVID-19 plan, a requirement for certain types of patient screening and management protocols, requirements for standard and transmission-based precautions, requirements for certain PPE, requirements related to for certain types of aerosol generating procedures when those procedures are being administered on a person with suspected or confirmed COVID, physical distancing requirements, next slide please, physical barriers, cleaning and disinfection requirements, ventilation requirements, health screening and medical management requirements, vaccination requirements, and I say that to mean encouragement of vaccination or support related to employees who want to become vaccinated, certain training related to safety protocols that employers are obligated to provide to their staff. There's an anti-retaliation provision, as we're generally used to, record keeping requirements, and of course certain reporting requirements specifically that live in this emergency temporary standard. So that's nice. That's great, Sandy. What the heck does that all mean? That means, again, that if here in Michigan, if all the things really did go away tomorrow, right? If all of the MDHHS orders were to go away, if the MIOSHA rule was to go away, if the Michigan COVID-19 Employment Rights Act was to go away, this federal OSHA standard now stands on its own. There are additional requirements that certain employers who are covered under this standard would be required to meet. And I believe that we're going to do a webinar specifically focused on that audience within the next week or so. So be on the lookout for that, and we'll do a much deeper dive into what that looks like. But it's important for all of us, particularly for those of us in the healthcare space, to recognize that there's been movement here on the federal side, that even if our MIOSHA rule goes away, there's now a federal standard that has the force and effect of law, just like the MIOSHA rule does. And we need to fold that into our analysis. Okay, next slide, please. Now let's talk about federal OSHA also updated their COVID-19 related guidance that is applicable to all employers back on June 10th as well. And so you might remember, and we have a number of webinars on this topic, that back in January, federal OSHA finally came out with some very specific guidance related to COVID-19 mitigation efforts, preventative measures that they recommended that employers in all industries should put in place. And it generally was, at that time, was a list of 16 type of requirements. Hillary Skolton and I covered those a little bit when we were talking about what we thought was a pretty imminent federal OSHA rule. At the time, we paid attention to those only to say what lives in this guidance that is different than what we're already required to do here in Michigan. Because if those became a standard, right, a requirement, that would be new information for, or a new requirement for our Michigan employers. And so we need to raise that to the top. And there were only a couple. So federal OSHA updated that guidance in June. And now that consists of 11 different recommendations, and several of those mirror the current Michigan requirements, whether they live in the MDHHS orders that will still be applicable, whether they live in MIOSHA requirements through the COVID-19 emergency rule or other MIOSHA standards that apply to the COVID-19 pandemic, right? We still have a hazardous communication standard. We still have a recording and reporting standard. We still have sanitization standards. All of those things still apply. Those are standards well before any of us even knew what COVID-19 was, and they still apply to the situation as well. And generally mirror, right? They contain isolation and quarantine recommendations, right? Recommending employers follow the CDC, which here in Michigan, we have the COVID-19 Employment Rights Act. So we already do that. So again, we generally paid attention to this as a data point, something to keep in mind, something to watch, something to highlight in terms of where it was different from Michigan's requirements. To the extent that something happens to our MIOSHA rule tomorrow or the next day or any time before October 14th, 2021, we maybe will pay more attention to this guidance, because then we wouldn't have a MIOSHA rule or MDHHS rules that kind of supersede this general guidance that are just really recommendations from federal OSHA. So let's go to the next slide, and I hope that we can kind of go through this and talk about Okay, that's all great and wonderful, Sandy, but what am I supposed to do today to get ready for tomorrow? Okay, so the first piece is understand what MDHHS orders will continue to apply to your organization, and you need to maintain compliance with those. So that list was in a previous slide, and so take a look at those. Hop on the MDHHS Epidemic Orders website and see which ones could continue to apply to you, because requirements for compliance related to those orders is unchanged. The second piece is to plan to maintain compliance with the existing MyOSHA emergency rules and all of the mitigation requirements contained in those, right? Until or unless we hear different from MyOSHA, we need to presume that those rules are in effect unless rescinded or revised until October 14, 2021. And of course, we need to watch for the MyOSHA announcement on Tuesday, and then you are welcome to join us for a webinar on Wednesday, where we talk about whatever it is that MyOSHA just said and how that impacts what you need to do come Thursday morning, right? Or Wednesday morning or Thursday morning, okay? You need to maintain compliance with Michigan's COVID-19 employment rights, isolation, and quarantine protocols. Those are unchanged and unaffected by the MDHHS rescission order. And then for those of you who are in the healthcare audience, want to start to take a look at that federal emergency temporary standard and determine if it applies to your facility. And even if it does apply to your facility, it might look a little overwhelming and you think, oh my goodness, these are all, here's a list of 15 things and I need to get my hands around that. Very likely, most of those are things you're already doing because they're already covered in an existing MDHHS order, the MyOSHA rules, CMS standards, and many, many other places. Most of those were, and again, speaking very broadly here, but most of the requirements in that emergency temporary standard are things that have been in place, at least here for Michigan healthcare employers for a long time. So before I hand it over to Erik, I'm going to take a look a little bit at the Q&A. I want to make sure that we've addressed some of the questions. One of the questions we are getting is related to, okay, Sandy, I've had to have these signs, right, on our business door that says to customers, hey, you're free to enter if you are fully vaccinated. You're free to enter without a mask if you are fully vaccinated. Do those signs need to come down? Yes, that requirement, right, lives in the MDHHS order, but remember, you still have a face mask requirement for unvaccinated employees that lives in the MyOSHA order. So again, this is kind of that differential, and understand that as we sit here today, it was kind of a building block of different agencies at the state level and at the federal level that have gotten us kind of to the compliance obligations that we have today. And some of those are going away, but those do not impact the others unless those agencies say, yes, those do impact us too, and those are going to sunset. But we need to watch and wait for those agencies to tell us that before we just unilaterally decide to do that, okay? Let's see. Talked about customers a little bit, talking about am I still permitted, right, to ask my employees about their vaccination status? Yes, again, under the MyOSHA rules, you have some obligation to require your employees who are not fully vaccinated to continue masking and distancing requirements. And as we sit here today, the EEOC, the Federal Equal Employment Opportunity Commission, still says that vaccination status, asking about or requiring proof of an individual's vaccination status is not a disability-related inquiry that would be covered under the ADA. And at least as we sit here in Michigan, vaccination status is not a protected class. That is not the case in all 50 states. There are a number of states that have passed legislation talking about that employers can't make distinctions in workplace requirements based on vaccination status. So it's important for you to understand the laws in your state or where your employees are. But as we sit here in Michigan, that is not the rule. Question here related to Public Act 238, which is the COVID-19 Employment Rights Act. And it says, does it protect employees who are out for COVID-related reasons in terms of holding them accountable for absences? And I'm not sure what that means, except perhaps, right, if I'm out for a COVID-19 related absence that's covered under Public Act 238, does my employer have the ability to count that absence against me for disciplinary purposes? And provided that the employee is out for one of the reasons covered under the Act and has complied with their obligations under the Act, no, those absences cannot be counted against an individual for disciplinary purposes. So it looks like those are all those are the broad questions that would be broadly applicable to this audience in the chat right now. I'll continue to monitor that as Erik talks to you a little bit about the PPP program.
And Sandy, thank you so much. As always, you're extraordinarily clear and helpful in your summary of these complex layers of rules and orders and what may spring into place as other rules are rescinded. So thank you for your continued clarity and help there. And I know that Wednesday webinar will also be very helpful, I'm sure, for our viewers and our clients. So I'll be relatively brief here on the PPP and SBA updates. Maybe one of the last of our PPP specific updates for a while. I think, as people know, if they've been following this topic, that the application deadline for PPP loans was May 31st. And for any application that was received before that date, the SBA has until June 30th to finalize the processing of that loan with banks and lenders. So it's possible that a few of our clients still have sort of in process new PPP loans that are out there, but in about 9 days, I guess, that'll be the true final day, barring any further legislative action of our kind of adventures with the PPP and the SBA, and at least on the new loan origination front. And what I want to talk about today briefly is some forgiveness trends related to PPP loans. And I checked again during the webinar briefly, and there's no more updated information than that which the SBA published on May 24th still. But I know that since that date, a number of clients and non-clients have reported that their loans of more than $2 million have now been forgiven by the SBA. So the SBA has said they're going to pay the loans to the lenders, basically saying you've reported to us the information that's required. We're satisfied that, at least for now, with your loan necessity questionnaire responses, that we can remit payment of your loan to your lender, so your loan's forgiven. There are some smaller borrowers, or even some borrowers with loans above $2 million who are still getting some follow-up questions from SBA, and those would be questions beyond the standard Form 3509 or 3510 questionnaires that the larger borrowers are all receiving. And if you already responded to the Form 3509, that's the one for for-profit businesses, or the 3510, that's for nonprofits, and you get additional questions from SBA, you should definitely contact counsel and your accountants quickly. You usually have a pretty short turnaround time for responding to these requests for additional information. It doesn't necessarily mean that your loan will not be forgiven. It could be just a kind of a random spot check, but it could be that there is some issue that is unclear or incomplete from your original forgiveness application request. It could be that the SBA is actually looking at the substantive issue for your need certification or your compliance with the program terms to achieve full forgiveness. So if you get additional questions, particularly after you've responded to that form 3509 or 3510, you do want to reach out still to counsel or accountants, probably both, to make sure you provide accurate and complete information to SBA before you get that initial determination about forgiveness. But overall, to return to the kind of headline point here, it does seem like we're starting to see SBA forgive more of those large $2 million plus loans, which is a big relief, I know, to many clients and businesses, not-for-profits of that size who have been waiting quite a while to hear about that, well past the 90-day deadline that the SBA had set for itself originally. However, even if you've gotten that full forgiveness determination or partial forgiveness determination from SBA, or your bank has told you that SBA has paid off your loan because it's fully forgiven, it's important to remember that you still have this document retention requirement. And basically this says, at least if your loan is above $150,000, that you must retain all documentation related, essentially all documentation related to your PPP loan in your files for 6 years after the date the loan is forgiven or repaid in full. So if you received a forgiveness determination at some point over the last week, this obligation continues in effect until, say, 2027, summer of 2027. And the other important thing to note is that, if your bank or SBA or any government agency wants to look at that documentation, the SBA has explicitly retained the right to come back and review any loan file at any time. So you just want to make sure that as you're kind of packing away kind of the information about your PPP loan after you get a forgiveness determination, if it's a favorable one, that take a look back at what you have there. If there's anything that you think should go into the file that helps contextualize your application for your PPP loan or your request for forgiveness, make sure you put it in there with everything else related to the loan and your payroll and your employee issues from this period, just in case, in a couple of years, you get a request, say, from the Office of Inspector General at the SBA, because they're doing, even if it's not specific to you, if they're doing some kind of audit of a particular industry or loans of a particular size, it could be that there's something not specific to your business where the SBA comes back, where your lender might say be under review by SBA and they need to produce files. So you really do want to make sure you comply with that document retention requirement, and store those materials in a secure, safe place or backup electronically. Make sure that there's several people who kind of know what the full package of information related to your PPP loan looks like and where it is. People come and go, of course. You may want to have outside counsel or your accountant hold on to a copy, of course. So make sure you just are thoughtful as you move on from that, and don't just assume that the forgiveness determination is the end of your obligation. Essentially, you do want to be thoughtful about preserving your record here, just in case there's some kind of future employee whistleblower accusation or a tax issue that comes up and results in SBA or some other governmental agency looking at your PPP loan in the future. So on the PPP front, that's largely what I wanted to cover for now. I think there was a question in advance of the webinar about whether SBA was accepting second draw PPP loan forgiveness requests yet. And the forgiveness application forms are certainly set up so that you can request forgiveness on those second loans. I would recommend inquiring with your lender, however, because even with the first round loans, it was so lender specific, whether they were accepting forgiveness applications through their portal and transmitting those to SBA. Some of the lenders were deliberately waiting until SBA simplified the process. Others were very quick in allowing for applications for forgiveness. So I imagine that it will be similar with the second draw loans. You just want to coordinate with your lender to see, even if SBA is accepting them, it's possible your lender is not at a point where they're accepting them yet and transmitting those materials to SBA. So you want to coordinate with them. But in theory, I believe you should be able to do that, if not now, very shortly. Beyond the PPP, SBA is really kind of moving on from administering these forgivable loans and grant programs like the Restaurant Revitalization Fund grants to longer term initiatives. One of those is, for example, the Community Navigator pilot program. And SBA leadership has talked a lot recently about, what they've learned over the last 15, 16 months, their increased visibility, and the media reporting on SBA, for better or worse, sometimes, probably more often than not, reporting that SBA was understaffed or subject to fraud in a lot of these programs, which is true. They just weren't adequately staffed at the outset of the pandemic to deal with administering, over $900 billion in small business loan guarantees and administering direct grant programs on this kind of scale. And that's not really their fault, right? I mean, this happened suddenly. So the SBA has talked a lot about, leveraging that experience into laying the groundwork for more proactive preparedness with small businesses, making sure that small businesses know what they offer beyond those programs, what kind of resources and programs are just available to, sort of even before COVID, like Sandy was saying in the employment law context, there were employee safety and health rules already in place that will continue in place and continue to impact employers. It's the same with the SBA. There were Section 7A loans before the pandemic, and I'll say, as a corporate and M&A attorney, I didn't pay a huge amount of attention to those things before COVID happened, but now a lot of people are aware of those things and the fact that there can be some real advantages to taking full advantage for certain small businesses of SBA programs. So, we'll continue to monitor those programs and developments and raise in webinars in the future some that may be particularly relevant to our clients and our community. A couple of programs, though, that are still technically open, they may not be open to all, they certainly won't be open to all of our clients because their eligibility criteria are narrower, but the economic injury disaster loan targeted advances, that program is expanding to reach some more small businesses that were particularly badly impacted by the pandemic and didn't receive the initial full amount of the $10,000 EIDL advance that they may have been eligible for. So that program is still out there, which was originally kind of by invitation only for those businesses that had previously applied for the targeted advance or for the advance and then didn't receive the full amount. But now, even if you didn't originally apply, but you're eligible, you can go back and have a look at that to see if you can, if you're a very small business, see if you can take advantage of that up to $10,000 advance. And then the Shuttered Venue Operator Grant Program, which has been rolled out with a lot of problems, frankly. It's been delayed, the funding for applicants, the opening of the portal. It's all been bumpy in its rollout. But that program is actually still accepting applications from eligible shuttered venue operators. So museums, concert venues, movie theaters, live music, performance halls, things like that. If you haven't applied for that and you're eligible, you may still be able to apply there. But for the most part, as I say, the SBA is winding down those programs, or they're winding down by the legislative terms that were put in place, and SBA shifting more to a longer term focus on leveraging the attention that it received during the pandemic. And the last thing I want to mention that we're going to be monitoring on the small business front, it's not really an SBA development, but it's sort of related, is all the American Rescue Plan Act funding that has come down to state and local governments may result in some, Michigan or other states or municipalities or counties implementing smaller scale programs that are similar to some of the SBA programs we've seen over the last year or so, hopefully learning from what worked and didn't work particularly well in different parts of the SBA arsenal of programs. And those will have, I think, more of a local focus. So, some of the money that finds its way to, Michigan or certain regions within Michigan might be used for agricultural grants or tourism grants, right? To be able to support certain industries. So we'll track that also, particularly here in Michigan, where so many of our clients are, to see what programs are coming online at the state and local level. And that's really all I wanted to cover today. If people have questions, I'll look in the Q&A. Sandy may have some more questions in her area to respond to, but I'll turn it back to Sandy in case she has anything else for now, and I'll take a look at the Q&A to see if there's anything on the PPP or other SBA developments.
Yep, just two additional things, excuse me, I wanted to mention. There's a couple questions in the Q&A that generally hit this theme, and so I thought I would just cover it. So there's questions related to, do I need to provide paid leave to my employee if they're off for any of the reasons covered in the COVID-19 Employment Rights Act, right? If they're off because of a quarantine or isolation requirement, what are the rules related to that? So let's just take this quickly step by step. So for those listening, you may be familiar with the Families First Coronavirus Response Act, which was a paid leave mandate for certain employers, generally employers who had less than 500 employees. And that paid mandate existed from April 1st, 2020 to December 31st, 2020. So that paid leave mandate has expired. Starting January 1st through a couple of kind of what I'll broadly say kind of economic recovery packages at the federal level. Effective January 1st, employers could choose to adopt a voluntary leave plan that incorporated any, all, or none of the FFCRA's previously covered reasons related to the COVID-19 pandemic. That was completely employer choice. And if you're thinking, well, why would an employer choose to do that? It's because there were tax credits available for paid leave provided under those circumstances. So generally, that choice started in January of 2021, starting April 1st of 2021, right? There was a list of 6 kind of COVID-19 related reasons that if an employer was providing paid leave under these circumstances, that paid leave was eligible for employer tax credits. Starting April 1st, 2021, that list of 6 became a list of 9. And there were 9 different reasons that an employer could provide paid leave for a COVID-19 reason, and that paid leave would be eligible for tax benefits. But as we sit here today, there is no federal or state paid leave mandate that is specific to an employee taking time off for a COVID-19 related reason, even if it is a reason required under Michigan's COVID-19 Employment Rights Act, right? If I'm an employee and I'm required to stay out of the workplace, or I'm an employer and I'm required to keep you out of the workplace, there's no paid leave requirement unless, specifically specific to COVID-19. However, here in Michigan and in many, many other states, there are what I'll just broadly call paid sick leave laws. Here in Michigan, ours is called the Michigan Paid Medical Leave Act. And that act generally, I'm speaking really broadly here, generally requires employers of 50 employees or more to provide paid leave to their employees up to a maximum of 40 hours in a year for certain medical, again, speaking pretty broadly, medical related reasons. And some of those medical related reasons would be for my own diagnosis, preventative care, all of those pieces. So to the extent my own illness, I guess is broadly what I'm saying. And if I'm subject to kind of a public health quarantine, isolation or quarantine requirement, right? So Michigan's Paid Medical Leave Act existed well before COVID-19, and it will stay, I presume, it will stay on the books well after COVID-19, but there are COVID-19 situations that could trigger an employer's obligations under Michigan's Paid Medical Leave Act. But as we sit here today, there's no federal or state mandate for paid leave specifically related to COVID-19 reasons. A couple questions in the chat were related to daycare, right? If my kiddo doesn't have daycare available to them for a COVID-19 related reason, is the employee, or if my employee rather doesn't have daycare available to them for a COVID-19 related reason, are they entitled to paid leave? And the answer to that is no. No, the federal requirement for paid leave expired December 31st, 2020. Anything after that is an employer's choice to voluntarily participate in that program. And so you'd want to evaluate whether your organization, that makes sense for your organization to do and evaluate it in those pieces. So I just wanted to mention that. And the last thing I wanted to mention is one thing we didn't hit on today that I think is really important is, remember, we've generally talked about state and federal requirements as it relates to the COVID-19 pandemic. There are always situations where your local public health departments, right, may have more strict requirements than what's happening at the state level. So it's important for us to stay abreast of those local developments. And as we look at the pandemic generally, we've seen those local requirements kind of wax and wane in terms of orders, right? In the very beginning, when there wasn't as many state orders, we saw a lot of local orders. But then we got into this phase where there were mission executive orders in those pieces. And a lot of those local orders were rescinded. Then we got into a space where the executive orders were no longer valid. And we had a small space before MDHHS orders picked up and the OSHA rule picked up, and we saw a lot of activity around local orders again. But as soon as the MDHHS orders became in place and the OSHA rules came in place, we saw a lot of those local rules become rescinded. So to the extent that now we're kind of entering another stage here in our pandemic journey, where we see a number of MDHHS orders maybe relaxing, we still need to make sure that we understand what local health authority has jurisdiction over our employment facilities, right? Who is it that what local public health authority are we communicating with, and do they have any additional orders or additional requirements that the state will no longer have? So I just wanted to make sure that I took a second to mention that to our listeners as well.
Great. Thank you, Sandy. That's a good reminder and very helpful. I don't see any questions here on the PPP side, and that's great. Sandy and I were joking before the webinar that the questions are so good from the audience and webinar registrants that we feel, we're proud that people are issue spotting and kind of able to navigate a lot of this. It's been a long time, and people sort of know what to look at and what the issues are. We feel like we've all come on this journey together, and you've made us better lawyers by asking good questions and keeping informed of things in real time. So as always, we want to thank you for attending the webinar today. Sandy's mentioned a couple of topical webinars coming up, and we'll continue to push out information about those. In terms of general COVID-19 updates, nothing scheduled right now for a roundup, and it'll likely be more, as I say, topical or issue-specific programming for the next couple of weeks. But we'll certainly reach out if that cadence of webinars or correspondence changes. And we really appreciate, again, your engagement, and hope you have a great day. Thank you.